Welcome back to What's Next, Living Longer, Better, Smarter. We're happy to have you with us. This episode is made possible by Tokyo-based Living Best, a consumer-focused age tech initiative from the Carter Group. The initiative helps to advance promising new ventures and technologies with the resources and connections they need to succeed. Learn how they are empowering the future in the world's most aged society in Japan with the potential for global impact. For more, visit living-best.tech. Let's get started. I'm Fred Fishkin along with Mary Furlong. Hi, Mary.
Hi, Fred. Fall is in full swing, and we have some really important news to cover today.
We do. We'll be talking about how to get help with the open enrollment period for everyone on Medicare. Stay tuned for that. First, we're going to tackle some stories making headlines in the area of brain health and Alzheimer's. There's new stuff, it seems like every 5 minutes, and we're going to hear about some of it. We're very happy to have back with us some familiar faces. Dr. Michael Roizen, Chief Wellness Officer Emeritus at the Cleveland Clinic, best-selling author of The Great Age Reboot, and more, and now co-founder of For Longevity Health. Hi, Dr. Mike.
Fred and Mary, it's great to be here. Thank you for inviting us.
Well, also with us, we have some big news from Posit Science, maker of Brain HQ, CEO Dr. Henry Manka. Great to see you again, Henry.
It's nice to be here, Fred. Thanks for having us on.
And Henry, we know how much work that the team has put into Posit Science, and we have some much needed encouraging news to talk about. First, the FDA has now approved a new blood test to help detect Alzheimer's. And Dr. Mike, maybe you can tell us in everyday language the details and significance of that.
Well, it appears your brain, when you are pre-Alzheimer's, up to 20 years beforehand, starts to leak abnormal proteins or proteins that are misformed that then cause or are associated with the development of Alzheimer's. And so they predicted up to 20 years in advance. Just to give people the names, tau 217, amyloid 4240, and one more that I'm not going to, but there are now 3 tests that are commonly available. They're available by both of the large providers of testing, Quest and LabCorp, in many of the local practices, such as Cleveland Clinic's own lab, will have those available in-house in a short period of time. So we're getting experience with these now, but they predict, and if you can predict 20 years in advance, then you can do something about prevention, not just treatment.
I understand that the test is intended for people who are 55 and older, this new one, who are showing cognitive decline symptoms. And for those, if Alzheimer's can be ruled out by a blood test, what would that mean?
Well, I don't know that it can be ruled out, but it certainly can be diagnosed. Now, what we call that is sensitivity and specificity of the test. Sensitivity is how positive is it in the disease? It's over 90% positive in the disease. Specificity is how negative is it in health? And that can be about 93%. So it's not perfect yet. And that's why we have 3 of them. But what it means, really, since it's 20 years in advance of the clinical symptoms, I think we will, although it's approved, meaning that's where the FDA has given its blessing, we often in medicine use things off-label. So, for example, if someone has a parent who had it or a grandparent who had it and wants to say, am I developing it? And the problem is, will they then do something different, like practice freeze frame and double decision, as I do routinely, without indication? But in fact, you can do this in advance and maybe prevent the disease totally. So although it's approved for 55 and older, we're doing it in people younger who are willing to pay for it. It's not that expensive, willing to pay for it and find out if they've got that and then they want to do something before they have any signs of cognitive decline. So that's where it will move. But for now, that's right, 55 and older, and who have some signs of memory loss. And every one of us will claim we have some signs of memory loss. It is. Do you know where you put the frozen corn instead of the frozen peas to
Ah,
treat your sciatica?
and there was another blood test approved earlier this year. What does that tell us about the research that's going on?
That's right. So there are now a group of three tests that have been approved. They can support one another. It turns out if you have a positive on one of them, then you probably don't need the next. And many people at that point just go with cognitive finding. Some people want confirmation where you would do a lumbar puncture or put a needle in the spinal cord and see if the protein is there. Many people do a PET scan, a scan that is a nuclear scan of the brain to see if the abnormal amyloid and tau are there. Henry will have some information on what the rest of us tell people to do. And the only reason to get the test is if you'll do something that will change its course. And the great news is we now have about 40 things that have been shown in two studies that change its course. But the major ones are food choices, portion size and timing, so food, physical activity, stress management, and then equal and maybe even bigger than all of those is practicing speed of processing games.
So,
Sure.
Mike, of course, you see patients all the time, and people, like you say, they have cognitive complaints already, but maybe they're not quite willing to start to, change their diet and their exercise and their cognitive activity. Do you think a positive test is that? Do you think what people are going to need to push them over the edge to say, hey, it's time to really work on myself?
What we're seeing is that with measurement of LDL cholesterol, much more than blood pressure, people somehow brush their blood pressure off because it varies. But they don't brush, brush off a solid number that they see consistently like LDL cholesterol. So we're beginning to see people pay attention to that and do something about diet and physical activity and stress with that, and food choices, obviously. And I think with the tau 217 or with the amyloid 4240, we're beginning to see, those are the two we're getting commonly, we're beginning to see people say, I need to do something with that. And we give them, if you will, the first four things, if you will. You normalize all the blood pressure and the LDL cholesterol so you don't have it. You then make sure diet is appropriate, physical activity is appropriate. And I hope you're seeing an increase in people doing speed of processing games. I alone believe I should be increasing the numbers based on my patients doing it. Um, but because I am pushing it as hard as I can. I'm even doing it in the, it's just Mary and Fred, just for I do this. I've done it since the first of the studies came out. I pay for it myself, so I have no bias. I'm probably one of his longest term subscribers, continuous. And I do, Saturday mornings and Wednesday nights are my getting healthy. So if you look every Saturday morning, I do either freeze frame or double decision or both I try and I do them for a half hour total. And Wednesday evenings, I do one or the other for a little bit of time. But I believe in this, and the science is so solid. I mean, you have Henry here, but the science from Posit Science is so darn good that I believe that virtually everyone who's worried about memory should be doing this.
I
And
love
that's
the way you frame things for us. Even my hairdresser is at the Cleveland Clinic getting advice, and so I really love the benefits that are being verified by real science, which has already been a part of the DNA from the start. And I like the way you teach us to do things on like Wednesday or on Saturday or, purpose, posse, and play. This is the news we can really use.
Let's get the news about that study from Henry. We haven't really gotten the nitty-gritty of that out yet.
Yeah, no,
Henry?
Mike is of course right on target here, and the breakthrough news that just came out, and I'm happy to share it with everyone here on your podcast today, is hey, for the first time ever, a gold standard randomized controlled trial funded by the National Institutes of Health has shown that a specific kind of brain exercise, and in fact, exactly the kind that Mike is talking about right here, two exercises in Brain HQ that drive speed of processing. For the first time ever, it's been shown that this specific kind of brain exercise can actually improve the health of a key neurochemical system in the brain. And that's really a breakthrough. So, the neurochemical that I'm talking about here is called acetylcholine. And this is a neurochemical in your brain that's released every time you're paying attention. If you're listening to this podcast right now and you're hanging on to every piece of good advice that Mike has for you, then hey, your brain is actually pumping out acetylcholine. And it's essential for attention, it's essential for learning and memory. And it's also one of the first signs of going on to dementia is that the acetylcholine production in your brain starts to decline. If you've heard of drugs like Aricept, which were one of the first drugs for Alzheimer's disease, well, that's a drug that, interacts with the acetylcholine system to try and keep the brain healthy.
Let me go and emphasize one thing. It is the speed of processing games. They did a very carefully controlled trial. So they used as controls a game like Solitaire and a game like Candy Crush. And the people did those for the same amount of time. And when they look at acetylcholine, if you will, quantitation in the brain, it increased significantly with speed of processing games and didn't do a darn thing with, if you will, you're playing solitaire or you're playing Candy Crush equivalents.
And,
You know,
Wordle doesn't count either, I guess.
I'm afraid not. Mike, you're exactly right to call that out. And, you and I were just talking about how important it is for this whole field of brain health to be running, randomized, well-controlled studies. And that was a key part of this study. Exactly as you say, I think often there's a lot of idea that, well, if we just keep our brains busy, we're going to be fine. Like, Mike, I don't know how many times you've probably had someone come to you and say, well, I do crossword puzzles, right? I'm never going to get Alzheimer's, am I? And you and I both know that we have to do more than just kind of keep our brains busy. What the science has really shown us is that we have to do things that make our brain fast and accurate. And those exercises have to be adaptive. They have to get harder as you get better. They get easier if you're having a bad day, but they have to really meet your brain exactly where it is. And they have to challenge your brain, right? That is absolutely right. And I think the same thing is true with physical exercise, right? If you're just,
I want to ask, I want to challenge Henry with a hypothesis I have relating to physical activity. When
let's hear
you
it.
do weights, you actually get stronger because you injure the muscle and you turn on a gene, our switches turn on that repair it.
Okay.
When you injure the bone with a jump, you turn on a gene that repairs bone and makes it stronger with, again, a repair system.
Yep.
Is it the repair system in the brain that's repairing this because speed makes you injure it, or is there what is happening? Do we know any more? I mean,
Yeah.
you've gone way beyond what we know already with this study. Do we know any more from the test tube studies?
You're really highlighting something super interesting here, which is in the brain, repair is actually the same as learning, right? If you look inside, so to speak, with brain imaging, what's going on when a person recovers from a stroke or brain injury, it's exactly the same thing that's going on when a healthy brain learns something new, like you're learning French or you're learning ping pong, right? What's happening both in repair and learning is the neurons, the cells in the brain, they are forming new connections across each other. They're strengthening certain connections. They're getting rid of others. They're rewiring essentially the network connectivity of the brain. And so repair, exactly as you highlight, Mike, is the same as learning. And so it is exactly the same process. And I think then the question you're getting at is, hey, why is speed so important, right? Fred, you mentioned Wordle. When you do Wordle, I mean, it's fun. I like to do the Wordle. My wife's got a 1,000-day streak, I think. But you're mostly just sitting there, right? You're thinking, but your brain isn't getting faster and more accurate. It's not getting harder or easier depending on where your brain is. So why is it this kind of adaptive speed processing drives these kinds of benefits, like that neurochemical benefit we just talked about? And the reason is if the brain is going to work well as an information processing system, it all has to operate like in sync, right? Everyone who's listening has probably heard of brain waves of various different types. And of course, Mike and I, and maybe many of you are familiar with all different kinds of brain waves that are required for attention and learning and brain change. And your brain has to be operating as a high precision information processing system with all of the systems in sync. And the way it gets that way is it gets faster and more accurate. But it turns out that's not just making it faster and more accurate, exactly like Mike is saying for muscle and bone. That process actually just rebuilds and repairs and strengthens the brain.
Given now, from what we hear from Dr. Mike and these studies, this works. Okay. Step us through Brain HQ a little bit. And how long will it take people to see a benefit? I mean, they can do it today and tomorrow. That's
Yeah.
not enough, right? So tell us about it.
Let's take one of the exercises Mike has talked about, double decision. And this is a key exercise in Brain HQ. You're working on your laptop or your phone, as the case may be, and you're looking in the center of the screen, and you'll see a little image appear. And it might be a car or it might be a truck. And if you had all day to look at it, it's very obvious which one it is, but it occurs quickly. It comes on and off. So it captures all of your attention in the center of your view. And at the same time, out in your peripheral vision, you see a road sign, and it might be at the 1 o'clock or the 5 o'clock or the 9 o'clock position. So you actually have to split your attention to see what's in the center of your screen and what's in the peripheral vision. And that might sound like an odd little task, and it is an odd little task, but what it does is as you do it, you get it right and it gets faster, and you get one wrong and it gets slower. It gets exactly right for your brain. And what it does is it is making your brain faster. To perform the task correctly, your brain has to get sped up and be made more accurate. And of course, you're paying attention, so you're pumping that acetylcholine while your brain is doing the speeded task. You're getting all this positive surprise, which is pumping a different neurochemical because things are appearing in strange places. And all of a sudden, what's happening is your brain's getting healthier, your brain's getting faster, and your attention is getting better. And that's all very cool if you're a neuroscientist. But I'll tell you, I was actually just talking to someone yesterday who's an avid Brain HQ user, and he told me, "Hey, Brain HQ saved my life a month or two ago." And that's always a pretty nice thing to hear about the work that you're doing, right? And he talked about being out driving on a Texas highway, and a car in front of him made a really dangerous lane change right into his lane. And, he could have had a terrible result, right? He could have hit the car, he could have overreacted and spun his own car off the highway, but he saw what was happening quickly and accurately. He made a nice, smooth, correct response based on his years of driving. And hey, he changed lanes and stayed safe. But he did all that because he had that fast, sharp, healthy brain as a result of the kind of brain training that Mike and I are talking about here.
That confirms what I have found with double decision and freeze frame. I do them together, so I don't know which is the thing because they were studied together and they have the result together. But I noticed that I was noticing cars in my periphery and cars much better than I ever have. And so it does improve your brain functioning. Mary, I should say, I wanted to say one more thing about Alzheimer's disease, if I can, because this is really a preventive. Today, the second large study came out that shows therapeutic plasma exchange as a treatment for reversing the cognitive decline. The AMBAR studies were the first, and I want to point out the difficulty of doing controlled trials. In the POSIT study, they actually used a solitaire game and a Candy Crush, monitored it in 50 people, and monitored the time they did it. Very tough to do the controls. And that's really why you want science and why you want good scientists. In the AMBAR studies, they put in the two IVs. It's a therapeutic plasma exchange, and they actually blinded. They put curtains over, sheets over the IVs so the patient couldn't tell whether blood was going in or not. And they ran the machine behind a curtain screen so the patient would think even though they were in the control group and not getting trials, they would think that the machine was that they were getting their blood purified. So the patients didn't know which they were. And then they looked at cognitive testing, and it didn't just slow decline, it actually reversed it. And so we now have something, if you will, that's been shown in at least two studies in humans to reverse early Alzheimer's. But as anybody knows, whether it is heart disease or stroke or a muscle injury, always better to prevent it. And Brain HQ has been shown to do that, and in a large randomized controlled trial, and now we know the mechanism. It actually increases your acetylcholine functioning in the brain.
So you see this as a really important app then, Dr. Mike?
I use it, as I said, I don't waste time, as you probably know. I don't have extra time to waste, but my Saturdays are mine. And in addition to physical activity and working hard in the gym and lifting weights, right afterwards, I have a couple salmon burgers and I go right into Brain HQ then. So
Wait,
Mike,
that's my Saturday routine.
that is inspiration to all of us. I love that.
and you call 4 friends over the weekend, so you also have
That's
some.
on Sunday, right?
Yeah.
That's
Okay.
correct.
I love your menu of activities. It's great to have some positive news to report. Congratulations, Dr. Mike and Henry, and for paying us a visit on this podcast.
It's a
Thank
very
you.
exciting time, as Mike has said, in this field. We're really seeing some progress thanks to just decades of science that's been done, but it's a fantastic time. Thank you for having us.
The websites are brainhq.com for more. There are free exercises there too, but you do need a subscription for the ones that Dr. Mike is telling us all about. And the latest from Dr. Mike is at the numeral 4, Youngevity, YOUNGEVITY.com. And I heartily recommend The Great Age Reboot. You can find that book on Amazon.
And Fred will all be together in Washington, D.C. at the National Press Club, December 15th, 16th, and 17th for the Longevity Innovation Summit. Well, it's that time of year once again when Medicare enrollment is underway. It can be pretty confusing for many of us, but there's help available. Joining us from Get Set Up is another friend, an amazing entrepreneur, Lawrence Cossack.
Fred, Mary, thank you so much for having me here today to help our audience better understand AEP and how they should think about it and what they should do to prepare.
Well, it is great to see you, Lawrence. Get Set Up, for those who aren't familiar, is a site that helps older adults learn all kinds of new skills and really take part in the community. So it goes beyond learning, I think. So give us the overview of the help that you can provide when it comes to this open enrollment period.
So, Fred, as you just correctly pointed out, Get Set Up's mission and focus is helping older adults learn the things they need to learn to live happy, healthy, more connected lives. And when we wake up in the morning, there's few things that are more important than our health. And so, 65 and beyond, we really do need to be thinking about AEP, which stands for annual enrollment, right? And so annual enrollment period is for people who already have Medicare, and it runs from basically the middle of October to the first week of December. For the changes that will occur the following January 1st, right? So now is the time that all older adults need to be thinking about their current health care. Is it correctly optimized for what it is they're going to need? And if it's not, what they should do about it.
So important. And many people are looking to make changes to try and save money this year. They're worried about the copays. You have classes and information that are both live and on demand.
Absolutely. And so, and we'll talk about sort of the kinds of classes we have as it relates to the number of changes that older adults could be seeing, happening to their health plan and want to make sure they're equipped to ask about. So we all have evolving health needs, right? Our medications change, our doctors change, our budgets, our priorities, all of those things can change, which is why we want to sort of reassess our health coverage each and every year. AEP is the right time to do it. And so the things that we really want to look at, and the questions that we really want to ask is, are my doctors and my preferred providers still in my plan's network this year, or has something changed? That's the first question I think that most of us need to ask. Are my current medications covered under my current plan? And if not, what should I do about that? How much could it cost me? And if I do switch, are any of my pills, will they cost more or will they be covered? So good thing to really understand, your current medication and anything that you anticipate might be coming in the coming year. And then what are my out-of-pocket costs? Like, understand sort of what's covered and what's not, and how much the out-of-pocket could be, because that requires a little bit of financial planning. And then you can actually use it to compare your plan to other plans. Now, important disclaimer here that, Get Set Up is not a brokerage. We're not paid by anybody. We don't give any kind of biased recommendations. What we're really trying to do is just help older adults sort of apply some real critical thinking to the plans they currently have, and see if those are right and that's the best way for them to proceed, or if they should be considering, asking more questions or looking at other options to make sure that they're keeping costs down and maximizing the effectiveness of their coverage.
Because it's very personalized. No two people have the same health needs. And so there are other sites that do offer assistance, but many are biased toward certain providers. So this is really unique and different.
Yes, I mean, we are certainly by no means the only place, but we are a safe, comfortable sort of place that people can come, where it's, older adults who help other older adults understand the options and the things that they need to be considering when thinking about health insurance. And so while there are other places you can go, and if you have a broker or a resource that you trust, and they always help you really think through what it is you need and what you don't need, that's fine. Stay with that. But if you're really wondering, am I getting the best recommendations? Do I really understand what's in my plan? If you look at your plan documents, and we spend a lot of time looking at the complexity of some of these documents, they're hard to understand. They're very hard to understand. And so, every year, we get what's called an annual notice of change. The industry calls it an ANOC, but an annual notice of change will tell you the difference between, what's coming on your healthcare coverage this year versus last year, and any differences. So, is your medication still covered? Did that change? Is your network and your doctor still sort of part of the plan? If not, do you need to be thinking about that? And so understanding those changes in a rather complex document that uses lots of acronyms that are really difficult to understand, is important for us to kind of help demystify for our older adult learners and say, okay, here's your annual notice of change. Here's the places you really want to look. This is what this means. So now you're equipped to go and ask the questions you need to ask to make sure that you do get the coverage most appropriate for you.
I guess it's akin in a way to, having friends that you can discuss this with, and they'll tell you what their plan is, and if they're happy with it or not. That kind of, you're getting a real community here. And one of the tough choices for people, can be really tough, is whether to enroll in a Medicare Advantage plan or stick with original Medicare with maybe a supplement. So many things to consider there, because you watch TV and the ads make it sound like the Advantage plans are so terrific that you're going to save a ton of money.
I mean, that's the one thing that's specific to the annual enrollment period, is that the amount of advertising that focuses on this audience and this category, it's overwhelming. I mean, there's not a news channel that you can turn on that doesn't have, some kind of a celebrity asking you, are you getting the benefits that you deserve? And like sort of really trying to sort of lead you to question your coverage, which in and of itself, questioning your coverage, that's not a bad thing, because you want to make sure that you are in fact making sure you do have the right coverage, which you may already have. You may have the right coverage, but you want to confirm this. And if you don't have the right coverage, well, now's the right time to sort of be looking at your options. But some of the language, and these are predominantly Medicare Advantage plans, and they do advertise quite aggressively, but they make you think that you may not have the right coverage. So they're really trying to get you to call. Now, that can be okay as long as you're equipped to ask the right questions. But if we can provide you with the learnings and the insight and the critical thinking, so that whether you're sort of calling one of those phone numbers or you're working with your broker, you know how to ask the questions around, is my doctor part of the network? Are my medications covered? What are my costs? Please explain to me the different benefits that I have in detail. Here are the ones that I think that I'm going to really want to make use of. And sort of that whole needs analysis, making sure that it's working for the older adult, is simply what we're trying to help with.
And it's the what ifs that you really need to get into, because you don't know what your health is going to be 3 months from now necessarily, unfortunately. And is that going to be covered? Things may look great today. Everything's covered. Your prescriptions are covered. You've got hearing and dental and all that. But if something bad happens, how much out of pocket are you exposed to, right?
Exactly right. Exactly right. So, and it's hard to know about the what ifs, but the best you can do is be prepared for, your current, making sure that you have the coverage that's right for you now. And, having a conversation with your doctor to understand sort of what your needs may be over the next 12 months, to understand, could my medications change? Will I be needing to make use of certain benefits that I'm not now, but could really help me? The planning just helps minimize the surprises. There could always be surprises, but it helps minimize those. And one of the most important things is the changes that happen at the plans oftentimes are, the removal of your doctor, your medication, some of the facilities that you've counted on and become comfortable with as part of your sort of healthcare coverage up to now. You want to make sure if any of those are critical and important to you, that those are staying inside the coverage of the plan. So good questions. Those are all good questions to ask.
You've told Mary and I before on the podcast about your AI tool named Helen. Does she get involved here?
She certainly does. Like so in many cases, the learners will sort of book sessions and come to the live classes and ask questions and sort of learn in this kind of interactive manner. We've also built some tools so that if an older adult wanted to, upload a document, like say the annual notice of change, and ask Helen to simplify it and put it into sort of friendly speak, everyday speak that we could understand. We use Helen and an AI tool to make it easy for older adults who may want a complicated document translated and summarized from, 30 pages or 80 pages into 3 pages, that explains the acronyms, explains some of their coverage, and helps sort of demystify it. And so AI and Helen can be that can be a really good use to help our older adults sort of find the answers they need and simplify some of these really complex topics and documents.
One of the reasons this is so important is next year in January, the boomers turn 80 at the top end, and they have more chronic conditions in their 80s than ever before. And it's the most well-educated older adult population. So having these tools and the peer-to-peer validation of what you should do is critically important. It just opens up a whole new community of people to talk to when we live in a world where we may not get out as much as we used to for a variety of reasons. We don't drive as far, we you have mobility issues, there are other issues. So this is really important and very exciting to see the progress of the company and the solutions, and very timely in this fall season. So congratulations once again, Lawrence, to you and to the team, and thank you for spending time with us today.
Oh, thank you, Mary. Thank you, Fred. And let me mention one more thing. Well, we spend a lot of time helping our learners navigate their healthcare options. We also spend a lot of time with health plans who are really thinking through, how do we make our content, our websites, our apps, our member portals more accessible to our members and to our older adult populations. And so we love it that these health plans are leaning in and wanting to make the content and the information more accessible. So not only do we get to help the learners, but we also get to help the health plans, and everybody wins because they meet in the middle. Accessible health plan information that's easy to understand is also much better for the learners, their members.
That's terrific. I had no idea that you were on that end as well, but I guess I shouldn't be surprised. Terrific.
Thank you for having me, Fred and Mary.
Research is really important to this effort. There's also help available from the National Council on Aging and from AARP.
And Mary, before we go, a quick reminder to those who are involved in the aging space and longevity that the What's Next Longevity Innovation Summit is coming up soon in December. Here is a little promo. The What's Next Longevity Innovation Summit is coming up soon, December 15th to the 17th at the National Press Club in Washington, D.C. Now, more than ever, it's time to connect with other thought leaders in the longevity ecosystem. Here's a taste of why you don't want to miss it.
You're in for, I would say, the Disneyland of the longevity market, because you're going to hear lots of ideas, lots of data.
So I'm Todd Heim. I serve two roles at National Institute on Aging. I'm the senior advisor to the NIA director on innovation, as well as I oversee an office that coordinates all of our training, career development, and seed funding programs.
Today is a important day for AARP. We are releasing the much anticipated annual Tech Trends study today.
We've worked on caregiving for a number of years. We'll probably talk more about that later. If you look at what's happened over the last year, you can say that we did put family caregivers on the public policy map. That was the work of a lot of organizations.
Right now we talk about it as just caregiving, but I think eventually even much more critical healthcare is going to start moving back into the home. I think you're going to have a shift away from hospitals into care delivery into the home.
Hi everybody, Greg Olson. I'm the director of the New York State Office for Aging. We've employed 28 public-private partnerships with tech and AI companies serving 1 million more people.
So we launched Get Set Up a little over 4.5 years ago, and it was 3 months prior to the pandemic. And as you can imagine, the demographic that we all serve here was more impacted than any other.
This year, our focus is on the next care transformation. For those in the longevity ecosystem, you can't afford not to be there. Register today at WashingtonInnovationSummit.com.
It will be another great gathering in Washington, D.C. during holiday season with a lot of the principals who are determining the future of healthcare in this country and people who have so much knowledge to share. Really looking forward to being there with everyone.
And we want to thank our guests once again, Henry and Dr. Mike and Lawrence, for taking time with us. And thank you to our sponsor, Tokyo-based Living Best, a user-first age tech initiative from the Carter Group that screens and adapts promising ventures and connects them with commercial opportunities and capital in Japan. Learn how they are empowering successful age tech investment in Japan, the world's most aged society. For more, visit living-best.tech.
I think they have their first woman prime minister.
In Japan, big progress there. We appreciate all of you for taking the time to watch or listen. Please help to spread the word, and remember, you can always find more at maryfurlong.com/podcasts.